So today's clinical pearl is identifying diabetes that's actually autoimmune instead of related to just dietary overconsumption of carbohydrates. So if you ever see a person who is normal body weight or skinny and they have all the laboratory markers or been diagnosed with diabetes, it's very possible that they really have autoimmune mechanisms as the cause. Also, if you ever see someone who is maybe they can be slightly overweight, yeah, or even overweight. But when you look at their dietary history, they don't have too much carbohydrates, they don't eat too much sugar. They're actually eating a very healthy diet. They exercise, despite the fact they're maybe overweight. They have a pretty good healthy diet and lifestyle. You should also suspect that they may actually have an autoimmune diabetes mechanism. And the way you would confirm that is just to run antibodies against these islet cells. So the most common antibodies to run would be islet cell antibodies. They're the cheapest, not necessarily the most accurate. The most accurate antibodies to really look for type 1 diabetes would be glutamic acid decarboxylase antibodies. Those have 70 to 80% accuracy for type 1 diabetes. And then the next one would be IA2A antibodies, and then the zinc transporter 8, ZN288 antibodies. So these can be done in a panel. You can just look at labs. They have type 1 diabetes autoimmune marker panels, and you can just run a panel with all of them on there. But if a person has, if it doesn't make sense why someone's diabetic, definitely run the antibodies. They may have an autoimmune mechanism. And really, with them, the goal is to try to control the autoimmunity. It's not so much a carbohydrate issue because these people are not really overdoing the carbs and sugar. So, hope that's a useful clinical poll for you. Thank you.